everyone, and welcome back to From the Front Row. Last week, we spoke with Dr. Lucy Lorian about urban planning, and this week, we're looking at another field that's at the intersection of place and public health, medical geography. My name is Radha, and today I'm co-hosting this episode with Garrett Naughton. And if it's your first time with us, welcome. We're a student-run podcast that talks about major issues in public health and how they are relevant to anyone, both in and outside of the field of public health. We're here today with Austin Tang, a PhD student in the Department of Geographical and Sustainability Sciences here at the University of Iowa. He also started working towards his Master's of Public Health in biostatistics here in the College of Public Health. We are excited to talk to him about the field of medical geography, his research on lead poisoning in Chicago, and much more during today's episode. Welcome to the show, Austin.
Glad to be here.
Could you tell us a little bit more about yourself and how you came to choose medical geography as your area of focus?
Sure. Like Radha just introduced, I am Tang. I go by Austin. I'm a PhD student from the geography department, and I joined the program of MPH in biostatistics last fall. I've also got my master's in geography here at University of Iowa, so this is my fourth year here now. I'm from Wuhan, China. So, if you're listening to this podcast, I assume you know where that is. And about how I got into the field of medical geography, I think this is quite an interesting journey for me. So a little bit of background. My parents, they both work in health-related industries or sectors. My mom, she works at a regional branch of CDC of China. So in China, the CDC system takes a hierarchical structure, and every region and city has its own branch. And my dad, he's a doctor, he's a physician. So although they all have this kind of health-related background, I have never thought of following their paths, and they also did not express anything like they want me to go that way either. So as I was choosing my undergraduate major, I kind of randomly bumped into geography as my major, where I learned a lot about spatial sciences, spatial analysis, and learned how to use GIS, so geographic information systems. So for my senior project, I was looking for some real-world topics or problems to apply what I've learned. And that was when I talked to my mom about it, and she was like, we do have some health-related data, and I think you can do some collaborations with us. And I was like, sure, why not, right? So I did my senior project on hantavirus, and from that experience, I realized that there's so much that geography can do to help public health. And as I explored this topic more, I realized that there is a discipline called medical geography, right? And I thought, that's for me. So interesting enough, I took a little detour, but this kind of family tradition finally still found me, right? And then I found that Dr. Carol, my advisor, she's an excellent medical geographer, and that's why I ended up being here.
Yeah, I guess spinning off of that though is, can you tell us a little bit more specifically about what does medical geography really look like, and the applications you can really use for it in everyday life or the healthcare fields?
Sure. So by definition, medical geography is a discipline that applies geographical concepts to health-related problems. So it's a pretty encompassing discipline. There's also this evolution of health geography and this kind of separation of these two closely related subdisciplines. So what I'm saying here is definitely just a very coarse summary, okay? So I think there are two big general topics under medical geography. The first one is disease ecology, which is a more traditional focus of medical geography. Researchers would look at diseases and the risk factors from a spatial perspective and understand the mechanisms of disease occurrence and circulation. So both communicable ones like COVID and non-communicable ones like cancer. This is also my main focus, so I apply spatial analysis methods to disease outcomes, and I like to call this type of medical geography as hardcore medical geography. Not to say that the other topic is not hardcore at all, and this entirely just my own labeling. Okay, no one else used this as far as I know. Yeah, but what I meant here is that under this topic, people work more closely with diseases and the risk factors. So probably more, medical by definition, right? And yeah, the other topic is understanding healthcare. Okay, so researchers would study the spatial distribution of healthcare provision, accessibility, coverage, etc., and they can provide public health policy suggestions to the betterment of the system. So yeah.
So let's talk a little bit more about you.
Yeah.
You mentioned that medical geography, spatial epidemiology, they all sort of define similar things. I want to talk more about the research you do and how your time in the geography department and your new budding time in the public health department, how you sort of came up with the idea for your research, your project. You recently published a paper called The More Things Change, the More They Stay the Same, Persistent Spatial Inequity in Pediatric Lead Poisoning in Chicago.
Yeah.
And I want you to walk us through that a little bit, like how you came about the idea, what made you decide to, pick this city, what made you decide to look at pediatric lead poisoning, and how you, ended up publishing this paper.
Sure, absolutely. So my research, like I just mentioned, I work more directly with diseases or health issues, right? So I have done projects, the one that you just mentioned, lead poisoning, right? As well as, so my master thesis was about H5N1 avian influenza in Indonesia. And my PhD program, I'm currently looking at antibiotic resistance in antibiotic resistance in bacteria. And that paper you just mentioned, it was a paper that it's a paper that was published earlier this year, that I worked closely with my advisor, Dr. Margaret Carroll. We published it together in the journal called Applied Geography. Yeah, so this was actually, I was doing a course project in Dr. Carroll's class, and it turned out to be very interesting, and so we decided to turn this course project into a full-length paper. And what are other questions?
I guess, I'm from the kind of greater Chicagoland area.
Oh, great.
I was kind of just wondering, what made you choose Chicago? Was it just location-based, or was it because they have, more of a significant problem with this lead poisoning, or is it just a problem that happens with big metropolitan areas like New York, Los Angeles, places like that?
I guess, yeah. So the initial rationale is that, lead poisoning, we know that, before 1970s, we had lead-based gasoline, and we also had lead-based house paints, and also with faucets and pipes with lead in it, right? And later on, these were all banned, but the impact of lead-based gasoline was quite obvious, because you just took that out and you don't have this air pollution with lead in it. But there are still a lot of old houses with lead-based paint in them, right? And they can produce house dusts with lead in them. And so generally a big risk factor is that if you're living in an area with a lot of old housing and with not very well maintained facilities, you will have elevated risk to have lead poisoning. So big cities with longer histories would generally have a higher risk.
And is that kind of where we see some of the disparity, because maybe like the lower income places aren't going to have the ability to keep up and maintain, and they're also going to be in the older probably areas too. Yeah. Okay.
Yeah, absolutely. So another thing is that we want to look at spatial differences. Right. So, like you mentioned, disparity is also a big contributing factor. And Chicago is kind of well known for its
I'm from there. I know
disparity, right?
It's
So
tough.
Yeah, we're thinking, what maybe that would be a good place to look at, and it's also close to Iowa.
It is,
so
it is close to Iowa.
kind of
Applications.
Yeah.
So, can you tell us a little bit more about how you think systemic racism plays a role in your research, or is specifically for the Chicago study?
Right. Yeah. Okay. I think I still need to walk you through the paper's
Okay.
method and findings.
Okay.
And then we can talk about how we think some of the backplay.
Okay, yeah.
Stuff.
Let's talk a little bit more about the methods for how you did this research. Can you tell us a little bit more about exactly how you went about doing this geographic research?
Sure. So we wanted to look at this issue from a temporally dynamic perspective, but also spatially how it varies across space in the city of Chicago, right? So we gathered data for 15 years, from 1999 to 2013, and looked at the percentage of kids screened with elevated blood lead level, how the rate has changed over time within each community area of Chicago. And and we also considered other risk factors. So we gathered census data and did spatial regression analysis and found some significant correlations or contributing factors for lead poisoning. We also did hotspot analysis to detect where our persistent higher rate of elevated blood lead level are in Chicago.
And what did you find out?
Right, yeah. So we basically found out that there are persistent hotspots in south side of Chicago. Although, in 1999, the average rate of elevated blood lead level was around 40 in the city, but when it goes to 2013, it became less than 5%. But like I just mentioned, there's still persistent disparity in the city. So the hotspot did not fade away. So
then,
the south side still has significantly higher rates of elevated blood lead level compared to its surrounding areas and the rest of the city.
Right. What do you think caused that that decrease? Is it just like efforts to actually like help the lead levels in that area?
I mean, I'm sure there were policy
Right,
efforts to
yeah.
reduce lead, to eliminate lead in paint and
Yeah.
eliminate lead in certain like packaging materials and things like that. So I assume that would have helped.
Right.
And like active, maybe lead testing. Do you think that could have played a role?
I think so. Yeah, maybe there's better coverage for testing, and also with more and more houses get renovated, people just generally have less exposure to lead.
But what your
Right.
research is telling us is that there's still this hot spot in south side of Chicago that despite a lowering of lead levels throughout the entire area, there still remains a higher level of lead poisoning or elevated blood levels of lead in the south side of Chicago relative to the rest of Chicago. Okay, so how do you think? I mean, we hear, south side of Chicago maybe isn't the safest place or things like that. Like, you hear all these stereotypes. I mean, you're from Chicago.
Right. Yeah, and
You've
I
definitely heard
understand,
those.
and it's just like disparities that like occurred to make it that way, and
Exactly.
like the way that people just kind of ended up there that might have had a better opportunity if the systemic racism wasn't as prevalent.
Yeah. How do you think systemic racism played a role?
Absolutely. So we actually found a significant correlation between lead poisoning and education attainment, renter occupation of the houses, minority population, and obviously average house age, right? So I think these are all, you can see them all as proxies, as or results of partly results from systematic racism, right? So we know that in Southside Chicago City, we have a higher percentage of minority population, And at the same time, we know that they also have higher average house age because of historical reasons like redlining and other housing discriminations.
Yeah, so for those of you who might not know what redlining is, it's this discriminatory practice in which services are withheld from certain groups of people and certain neighborhoods which are classified as hazardous or not really ideal for investment. These neighborhoods are, they have racial minorities, ethnic minorities, low income residents, and they have been essentially closed off from access to good resources, or they live in more dangerous areas purely because of, systemic racism and like the government, like certain efforts on part of individuals in the government to separate and segregate individuals. Yeah.
Absolutely. So those are the areas that got left off in this history of community development, right? So, what people do when they try to invest into in an area, they just come in and renovate the houses, build newer houses without lead poisoning, without lead-based pipes. Yeah, when a region is developed, they would come in and renovate older houses and just have new buildings, right? And these areas, they did not get enough resources to keep up with this with this development trend, right? So they also have just a higher average house age, which is a significant risk factor for lead exposure.
Right, and I guess kind of going off of that, because that's kind of one way that an effort could be made to like reduce lead exposure, lead poisoning. What other efforts would you like to see or could be done by either local government or like even individuals that could assist in the decreasing of lead exposure?
Right. Another very interesting finding we got was that although we see gentrification going on in Chicago very extensively. In those gentrified areas, we see a dropped rate of elevated blood lead level, but if we also look at the demographics of that area, the change over time, we also see that there is a significant drop of minority group and huge increases in median household income. So we can see that these kind of processes of gentrification would drive those minority group out and also drive those original residents that could not afford this increase in life expenses, right? So although gentrification brought down the lead level in children, it did not help the original residents that lived there.
Right. It's a double-edged sword of gentrification.
Yeah, right, definitely. So I think if we want to really help those people we intended to help, I think we should provide pathways that is not reliant on just moving to another area, right? We have to help them on site, maybe provide more resources for better renovation or better checks at houses and houses that are old, right? And we also mentioned that there's a significant correlation between renter occupation and lead poisoning, right? So maybe it's because that renters have less agency in controlling this issue in the house because that's their temporary
Housing?
Yeah.
That's their temporary housing, right? So maybe we can also require the landlord to better account for this exposure or this risk in the housing that they're leasing.
Mm-hmm. And I guess, like, switching gears, looking forward a little bit, like, you had talked to us before we started recording about your other research that you were doing about antibiotic resistance. That's, yeah. I mean, if you wanted to talk about that, you can. But what future research, I guess, are you going into and looking forward to, start working on?
Sure. I'm very, very excited about this PhD project for my thesis, which is about antibiotic resistance. So we're trying to study the geography of antibiotic resistance, probably mainly in the US. So we know that there's a huge issue of growing antibiotic resistance, and it's also highly related with its extensive use in livestock, right? And so, for example, in Iowa, we have corn, and we also have
Soybeans, pigs.
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 Okay. Well, we also have
1.5
soybeans.
1.5
sure.
pig per person, I think, is that the stat? Something like that.
I just know that
Six.
the
Six-
Iowa
six
pork.
pigs.
Is it 6 pigs?
I just
per,
know-
per person.
Per person?
Per person.
I just know that the
I love
Iowa
that
Pork Association is right next to the
Do you know-
public library I went to.
Did you
Oh,
know that,
is-
did you know that
not
the
at
Pork
all.
Association actually just runs this with state? No.
No, yeah, the Iowa Pork Association runs the entire.
They actually
state.
they have a big
I've run
sway
into
in
them
public
so
government.
much, like even in like speech competitions, like
The Pork Association was sponsoring it.
No, we stayed at
Get
the
a pound
same
of bacon if you
hotel as
want.
the Pork Association.
Okay.
Yeah, well, here's the deal. I'm vegetarian. I don't know
Oh,
much
that's
about pork,
fair.
but I do know that there's a lot of pigs in Iowa. But we also have soybeans. All right, keep going.
True. Yeah.
There's a lot of
So-
everything.
Oh, I'll start.
Tell
with-
us about pigs.
Yeah, we have pigs, right?
love
I think
pigs.
the demographic is like we have 6 pigs per person.
Which is
6 pigs per
I think
person.
I think
Yeah.
I think we need more.
Cool. Great.
Where did that go?
Oh yeah, have more bacon.
Oh my gosh.
Right. So you know that antibiotics are used in raising pigs, and we have these large how should I say this?
It's like a large population. I mean, coming from a microbiome area, I know how bad that is. Just like a general application of antibiotics for not knowing what you're using for is just the worst thing you could probably do, because it's just going to develop these resistant microbes that are just going to be so tough to deal with.
Yeah, and they are all like they're all raised in. Most of them are raised in concentrated animal feeding
Right,
operations. So these huge hog farms, and they consume really huge amount of antibiotics, and a lot of the antibiotics used in pigs, they're also medically important for a human, so that they're also used to treat human infections. So I think about a decade ago, people already found that if you live close enough to a hog farm, you have like 3 times of the risk of getting methicillin resistant Staph aureus infection. And now, because of that, UIHC now actually screens for MRSA, or methicillin resistant Staph aureus, before doing any operations. So we know that there is elevated risk, but we also know that it's highly related to the local landscape. Here we have hogs, and different animals or livestock would use different types of antibiotics, right? So we would assume that different regions would have this different resistant profile in local strains of bacteria. So if we can get better idea about how the profile differ in different regions, then we can use that to better facilitate our drug or antibiotics administration when it comes to clinical practices.
I'm really excited for you to go more into this, because you just started this.
I just started this. I'm still looking for data.
Exactly, yeah. But, you've already done one project that, lead poisoning in Chicago, and now you're completely switching gears to antibiotic resistance.
Yeah.
So that shows just how varied, I guess, spatial epidemiology or medical geography is.
Yeah.
So I guess, just from you, we've learned 2 completely different perspectives are possible. But could you tell us, maybe in a sentence or 2,
Right.
why you think spatial perspectives are needed for public health? Why?
Absolutely.
I mean, we've already seen evidence based on your previous work and what you're working on now.
Yeah.
But maybe if you had to give a campaign pitch for it, why
Want
do?
people to
Or
join?
more
Yeah.
generic introduction, right?
To join the medical.
No, we're
department.
trying to get people to join the cause.
Yeah.
Sure.
Why do you think spatial perspectives are needed for public health?
Absolutely. If you don't mind taking more than 1 or 2 sentences.
Good enough.
So I guess, I always remember this when I was a kid. My teacher told me, if you want to tell a good story, you have 5 W's, right? So can you?
Who, what, where,
When,
when,
yeah.
why?
The
What
question-
about how?
yeah, all the questions.
That's an H.
The how, That's not as important.
Not as important. But we know that there is where in it. So where things are happening is a essential component of a problem, of a story, right? If you want to tell a good story, you have to tell us where that is happening, right? So that I think that is generally what people are interested. So where is an important part of the big picture, right? We want to know where diseases are happening so that we can get to them more efficiently, right? So this is why it's important, and why space is a useful perspective. It's also that disease or risk factors, they happen in space, and the pattern of distribution is not random. So I'm trying to think about some examples. Like we just mentioned in the project, right? So the lead poisoning does not happen equally across space. There are places with elevated blood lead level. So if we can understand better about how the risk factors are distributed in space, we can use that to better understand how diseases are happening in space, or do predictions.
It's like a deeper connection to like an epidemiological study, pretty much. It's like it's a specified area of that, I guess.
I guess, yeah, and since you are from public health, I'm sure that you all know Jon Snow, right?
We love Jon Snow.
Right, we love Jon Snow.
He's our guy.
The father of public health, is that?
Epidemiology, yeah.
Of epidemiology.
Yeah.
He's the father of epidemiology, and his famous project is also spatial, right? He drew a map of London, those few blocks, and he also
track the water in the area, and he kind of just asked people, "Hey, where'd you get your water from?" Like, and
He basically identified
it was
the
early,
distribution of cholera
right.
around with a map.
Yes,
and he ended up finding out that it was related to a water plant, not a water plant, water treatment.
It was a water pump.
Pipe.
It was
Water
water
pipe.
pump.
I should know
removed
this.
the handle.
Yeah. A
And
water pump.
It was a very famous story. It's very
famous.
Right. Yeah, so that is, I'd say it's essentially kind of a hotspot analysis, right? Because all the cases are happening so closely in space that it must have something there. It must have something there that is causing this cluster, right? So I guess public health from its epidemiology, from its beginning, has a spatial component to it. Then I think that is also why we need to take care of that.
And with the aid of technology,
Absolutely.
you guys can do so much more. Like, you don't have to rely on small hand-drawn maps.
Absolutely,
You can
You
really
don't have to
get
ask people,
so much
where
data.
do you get your water?
Yeah. You get to use, data and fancy programs, and I'm sure you code all the time in order to analyze your data and get your results much faster and much more effectively.
I think that's exactly the case. I think a lot of people think of geographers as map makers or cartographers, but that is really, really the last step of our research, which is data visualization, right? But you can also, there are so many things you can do other than data visualization. For example, data management. You can put layers and layers of data all together into one database, and then you can do data analysis, right? Do hotspot analysis, do hotspot analysis, do network analysis, and all different types of spatial statistics.
So I guess we can say medical geography is both the past and it's also the future.
Well, I guess you could say that.
Yeah.
So I think that's a really good place for us to sort of wrap up. We have one more question for you. It's the question we ask all of our guests. And it could be about anything. I know it's scary, but it's just, what was one thing you thought you knew, but were later wrong about? It could be about your project. It could be about medical geography. It could be whatever you want it to be. What do you think?
Yeah.
What was one thing, maybe when you came into medical geography,
what
you thought you would be doing,
yeah.
but you realize you're doing a lot more of something else, or...
Yeah, I started living alone this semester. I thought at the beginning it was going to be hard because it's just a lot to take care of for this one household. But yeah, later I freaking love it. So.
Hey, it doesn't have to be academically related. We ask this question to everyone. Sure. We just want to know, because we want people to know that it's okay to be wrong, and you learn from everything. So, we learned a lot about medical geography today. You learned from living alone.
You're welcome.
Yeah, there's so many things we can learn from just, our interactions. So, thank you so much for coming to the podcast.
Thank you for having me.
Yeah, if any of our listeners have any questions, I'd encourage them to check out his paper. It's called, once again, for the people in the back, it's called The More Things Change, the More They Stay the Same, Persistent Spatial Inequity in Pediatric Lead Poisoning in Chicago. And we'll see what else you bring to the table in the future.
It's a very artistic name you came up with there.
Yeah.
Too. We didn't even get to that, but
yeah, it's a good name.
It's a very good name for a research paper.
And that's it for our episode this week. Big thanks to Austin Tang for coming on with us today. This episode was hosted by Radha and one of our newest members, Garrett Naughton, written and edited by Garrett Naughton and Anya Morozov, and produced by Anya Morozov. You can learn more about the University of Iowa College of Public Health on Facebook, and our podcast is available on Spotify, Apple Podcasts, and SoundCloud. If you enjoyed this podcast and would like to help support the show, please share it with your colleagues, friends, or anyone interested in public health. Have a suggestion for our team? You can reach us at cph-gradambassador@uiowa.edu. This episode was brought to you by the University of Iowa College of Public Health. Until next week, stay healthy, stay curious, and take care.